The use of paracetamol during pregnancy has been linked to an increased risk of ADHD in children. The research has sparked interest worldwide, but independent experts say more work is needed to establish a clear causal link.
Expectant mothers are bombarded with research suggesting that everything from tobacco to alcohol to mercury from fish can affect their baby's development. Now, paracetamol, a common pain reliever routinely prescribed to pregnant women, is being linked to attention deficit and hyperactivity disorder, ADHD, in children. More than 64,000 Danish women were surveyed over 6 years. The study found pregnant women who took paracetamol had a 37% increased risk of their child receiving a severe ADHD diagnosis and a 29% increased risk of their children needing ADHD medications.
Any medication in pregnancy is something to avoid if you can. We have to be extremely careful what we expose fetuses to.
Here, Dr. Florence Levy of Sydney's Prince of Wales Hospital has spent years studying the brain circuits involved with maintaining attention. The new findings, she says, are interesting.
It could well be that there is an effect on the development of these sensitive brain circuits. I mean, there have been other effects postnatally shown with other toxins like lead.
Experts caution that these are just observed findings of a link and far from proof that paracetamol can cause this hotly disputed condition.
It's a well-conducted study. I mean, one study is never enough.
In the meantime, the authors have this advice.
You certainly should not just take a pain medication because you have maybe a slight headache.
Both GlaxoSmithKline, the maker of Panadol, and the Australian self-medication industry, a peak body of over-the-counter health product manufacturers, say they'll study the research and urge pregnant women to consult their doctor before taking any medication. Previous research has suggested paracetamol can interfere with normal hormone function and may affect the fetal brain. Raina Sarapayat, SBS World News.